I coached her through pushing, monitored the baby's heartbeat, and managed the Pitocin. I was a newer nurse, and working a delivery was always exciting. We were making great progress, and I could see the baby's head descend into the birth canal with every push. Until all I saw was blood. Physicians and nurses flooded the room, preparing the mother for emergency surgery. Other nurses ran to get the elevator. I stayed beside my patient to reassure her. As the elevator doors closed, I saw the blood dripping off the bed, leaving a trail down the hall. I had no idea what had happened. The surgical team performed a quick C-section, and we heard the most beautiful baby cry. I had been fine until that moment. The mother's uterus had ruptured. In the weight of the moment, I froze. My charge nurse saw my wide eyes and blank stare, and without hesitation, she said, "It's okay. I've got this. Go take a minute." I stepped out and cried as my emotions washed over me. I don't think I realized what my charge nurse gave me in that moment until recently. A decade later, in the same hospital, this time as faculty, teaching a clinical rotation, I'd placed one of my students in the pediatric intensive care unit. As I was rounding, I found her, wide-eyed, standing against a wall in a crowded patient room. As we locked eyes, she started to cry. We moved to the hall to talk, sitting in chairs right outside that same elevator. The child was suffering from an intentional drug overdose, and there were questions of whether or not care should be continued. The uncertainty of the child's fate scared my student. I just listened. Eventually, we prayed together. It's okay to cry. For patients and families to see you cry, your tears show you care. I encouraged her to remember this day and not lose her compassion. Unfortunately, the emotions may not always be as powerful. As nurses, we often condition ourselves to deal with trauma without emotion, but try to hold on to your empathy. "How do I do this?" she asked. I didn't have an easy answer. We've kept in touch over the years, and recently I asked, "Do you remember that day?" She said, "I remember exactly what you said. I'm not sure you know the impact that you've had on my life." And thinking back to my charge nurse, I said, "I think I do."